so much. Dear colleagues, I'm Dr. Philippe Nuytens, and I'm delighted to be here with you today. It's a real privilege to represent Dynamic Abutment, and Dynamic Abutment Solutions is actually a pioneering company from Spain that is transforming the way we approach implant dentistry. I'm excited to share some of their innovations today. So first of all, the success story of Dynamic Abutment Solutions began in 2004 with the groundbreaking dynamic tie base and the introduction of angled screw channel technology, an innovation that fundamentally expanded the restorative possibilities in implant dentistry worldwide. Another remarkable milestone was the development of scan bodies with lateral side arms. Most recently, this company took a major step forward in digital intraocclusal recording for full arch implant restoration. And you have to watch out, this is a new thing. I'm very proud of this achievement as I hold the US patent for this digital bite restoration technology. I truly believe that these three innovations allow us to complete the digital circle for full arch registration. But let us focus on the first invention of Dynamic Abutment Solutions. It takes us back to 2004, when Esteban Xamar, a close friend of mine from Spain, made a discovery that changed everything. The angled screw channel technology. More than 20 years ago, so time flies, that simple and brilliant idea transformed implant dentistry, opening possibilities we had never imagined before. It has helped to solve 1 million of cases with angled screw channels, and its impact continues to grow. Today, many companies have developed their own versions, we know, but it all traces back to that single moment of innovation of Esteban Xamar with his angled screw channel technology. One key aspect of Esteban's work deserves special attention today. While many companies often angle their screw channels, Dynamic Abutment Solutions truly leads the field. I can handle cases up to 45 degrees compared to the usual 25 degrees, which makes a real difference in everyday clinical practice. The innovations doesn't stop here. Dynamic Abutment Solutions has also an angled solution for the multi-unit platform. And that may sound surprising. After all, a multi-unit abutment is already angled. But the next clinical case in the anterior region I want to show you will show you the real impact. This is not my best clinical case, I will admit. The surgeon had already placed angled multi-unit abutments in the anterior region. And as a prosthodontist, I try everything, but I took the intraoral scans and I designed and fabricated my immediate loading restoration with straight screw angle. I noticed a problem. The screw channels in the anterior region were emerging through the buccal aspect of the restoration, like you see. But at that moment, replacing the multi-unit abutments would have been too risky. So we proceeded carefully. We placed the restoration, allowed 4 months of healing and temporarily sealed with composite resin. And in these moments, our ability to adapt makes all the difference. Because we explore our options. Replacing the abutments, too risky. Redesign the prosthesis, possible but complex. Using angled screw channel technology, yes, because this solution could bring precision, stability, and simplicity together. As you can see, it worked beautifully. Thanks to the angled screw channel technology on 6 multi-unit tie bases, so the dynamic tie bases of Dynamic Abutment Solutions, very dynamic, Our final restoration could be milled from high-quality zirconia. The result was this prosthesis supported by angled dynamic tie bases, precise and stable. So in the end, we didn't need to replace the existing root unit abutment, and we avoided peri-implant tissue trauma. The anterior screw exit channels could be positioned perfectly on the palatal sides, making the restoration both functional and aesthetic. That is truly a remarkable technology, especially as offered by dynamic abutment solutions. A second exclusive feature in their full arch workflow is this system, reference scamolies with peak pins, the lateral attachments to the scamolies. Thanks to this full arch scamoli system, we can capture accurate digital impressions even in challenging situations. When the scamolies are located far from each other, or when the arch geometry complicates scanning, it allows us to work with confidence, moving toward predictable, highly precise restorations. As you see, I'm scanning and the implants are far from each other. No worry, we can handle it. And what is the key to improve the intraoral scan accuracy? Dynamic abutment solutions has these peak pins. We use horizontal scamoli attachments, these peak pins, and we attach them to the reference scamolies before we begin with intraoral scanning. At this moment, now, there are 5 types of peak pins, from A to E, each with a different geometry. Personally, my favorite is type B. A recent study of Kay and his team demonstrated that these lateral attachments effectively halve the margin of error. For example, when using a Trios 4 scanner, the margin of error decreases from 100 micrometers with traditional scamolies to just 50 microns with these horizontal attachments. The margin of error is reduced by about 50%. This is a major improvement that leads to more predictable and highly accurate full arch scan results. I've been using this magical system for 3 years now. I use it for my full arch implant cases and also for my immediate loading protocols. I can say without hesitation that for me, it is the ultimate system, delivering the highest level of accuracy. Here you see I'm using, so the stitches are still there and the immediate loading restoration will be there in 10 minutes on the slide. These radiographs demonstrate a perfect passive fit of the fixed implant restoration scanned with the new full arch scanning technology with peak pins. You see on the radiographs multi-unit abutments, they are passive fit on 6 implant positions. So no worry, you can use it for your passive fit. A recent clinical study by Fu and his team, and I repeat, it is a clinical study, no in vitro study. Fu and his team shows that this technology achieves results comparable to stereophotogrammetry. For most dentists and prosthodontists, the intraoral scanner has already become part of everyday practice. Today, it's all about the workflow you choose for full arch restorations. It defines not only your accuracy and predictability, but also the time you spend with your patient. And among all options, IOS remains, in this clinical study, the most efficient workflow. So we can state that technology has matured to the point where a single accurate scan with an intraoral scanner can replace the stereophotogrammetry plus iOS combo without compromising passive fit. And of course, the closer these lateral pillars or these lateral attachments or the peak pins or to the ground, the mucosa, the better. That's exactly what we learned from the recent study of Wu and his team. So, conclusions today. It halves the margin of error. Like for instance, TRIOS 4 goes from 100 micrometer to 50 micrometer. That's a whole game. The iOS stays the most efficient workflow compared to open tray impression and stereophotogrammetry. A single accurate scan with iOS can replace the stereophotogrammetry iOS combo without compromising passive fit. And the horizontal attachments, these second invention, the peak pins, well, when they are near the mucosa, and I can show you models there, when they are near the mucosa, they result in a superior trueness. Let's call superior accuracy. Third, intra-occlusion registration. The next digital tool is actually my favorite. I was waiting to present this to you here in the US. It's the first time I can present it in the US. I'm from Belgium, so I'm happy to have a patent in the US. And it's a new system for inter-occlusal recording with an intraoral scanner. Like I told you, everyone has now an intraoral scanner. Just grab it and use it. And I have a tool. I'm going to show you. Returning to the full arch intraoral scan with lateral attachments or peak pins, the next question is, how do we obtain inter-occlusion records? And actually, these questions were answered by the revisers of the Journal of Prosthetic Dentistry when I sent my first paper to them. They accepted it after some time. I was very happy. Do we need a wax ring or an implant-supported splint? That was a question arising in my head in 2013. In other words, must we revert to the analog workflow to record the patient's vertical dimension and centric relation? Or can we perform a digital bite registration? The answer is simple, yes. This is the moment I can show a trick for full arch digital bite recording. If you spend 10 minutes on the full arch implant scan, you can spend another 10 minutes on a digital bite registration. So be clever and use occlusal pillars. This innovation has already saved me hours. Today I introduce CAPS. CAPS are the complete Arch Pilar System, including the peak pins and occlusal pillars. Here you see my patent. The key innovation of the patent of this system is this sentence: a bite pillar configured to be attached at the coronal end of the scan post. So I repeat, a bite pillar to be attached at the coronal end of the scan post. It works like extendable table legs. A simple, clever idea to stabilize vertical dimension during the digital workflow. And here you can see how my system is applied clinically. Attach the peak pins to the scan bodies and take a digital impression of both arches. Place the occlusal pillars, at least one at the left side, one at the right side, and determine the vertical dimension for the prosthetic rehabilitation. And finally, let the patient guide you to their centric relation. Because in this system, the patient doesn't feel the volume of the wax ring. And that's the thing about this system. I'm going to show you. This digital system is called CAPS, as I told you, the complete Arch Pilar System. It provides outstanding full arch scan accuracy, like I showed you with different papers. You can use it for digital bite registration. And the best part, everything happens in one single visit. It's perfect for immediate loading. Occlusal pillars are now available on the market with two platforms, a normal platform and a wide platform. That was that day I called the company, I said, no, we must have a wide platform. A platform of, not 4.8, but a platform of 6.5. This design allows us to obtain intraocclusal records in almost every patient. It is essential to place at least one occlusal pillar at each side to ensure stability and accuracy. This innovation has truly changed the way I work. It allows me to achieve cleaner and faster results, even in the most challenging cases. Here you see virtual records. Virtual records can be obtained immediately after intraoral scans of both arches. The pillar technique is a straightforward and easy to learn technique. As you see here, right side, left side, and we are taking our buccal bite scans. At the very beginning, your dental technician may ask if you are certain about the inter-arch relationship you just sent to the lab. Because normally he does not get such scans, and for sure it will be the first time he sees this, but once they see the image of occlusal pillars, everything will become clear. Because it holds your bite, it can stabilize both arches. To design a full arch restoration, there is no need for additional files or scans. With this novel technique of CAPS, the design can be fabricated immediately. Using this technique, based on some very simple key concepts, we can deliver an immediate loading implant restoration quickly and efficiently. Like you see here. And remember, 95% of the work in your prosthetic clinical office is made by this prosthesis, this temporary prosthesis. Because the final, I'm not thinking about the final now, I'm thinking about the temporary prosthesis. And after all these years, I finally feel comfortable when a patient returns for the delivery of the provisional implant restoration. Because I know the centric relation recorded with the occlusal pillars is precise. So as you can see, the patient is happy. It was one single appointment, I did everything with CAPS, and I milled myself my PMMA restoration, which I will show you now. Later we can make corrections to this provisional restoration, but here we see the patient is smiling with the result. I've created my tools and I use them. And of course, and you see on screen occlusal pillars, and of course, you're more than welcome to use them too. This is the new 5-axis milling machine of Dynamic Abutment Solutions. And for me, this is the perfect partner for the full arch workflow with CAPS system. I have this machine for 3 months and I use it every week. I mainly use it for chairside milling of these PMMA immediate loading restorations. I can design, I can mill, and I create the bite and scan. And it has been a great success. If you're interested, my colleagues Javier and Guillaume of Dynamic Abutment Solutions can provide you more information about this machine. Here you see the result of a PMMA immediate loading restoration. Even when the angle between two implants differs slightly, I am able to mill and deliver the full arch restoration. These implants differ, and the machine can handle it. The real strength of the 5-axis chairside milling machine is that it allows us to mill the multi-unit connections directly in the PMMA. And it is more important for us to look to the clinical cases, so let's have a look to some more clinical cases to understand the CAPS system. Let's dive into my office. A patient with 4 implants in the lower arch presents for restorative treatment. As you can see, we have already placed the reference cannulas with peak pins on the multi-units. Here I have mounted 2 occlusal pillars on each side, and I am checking the vertical dimension of occlusion with the patient. And the good thing of that system is that when you guide your patient into the right position and you have obtained the good vertical dimension, which will take some time and maybe one case to feel how it feels, but you can take your intraoral scanner, you guide the patient in centriculation, you have a good vertical dimension, and then you just scan and take the buccal bite scans. It feels a little bit different because you don't have the wax ring or something else, but here after some seconds I just have this. And when my colleagues come to my office and they say, well, what are you doing? I always have to explain that this is a bite registration because they don't understand. So actually, in some seconds, we have this. It's a new technology, and actually when you use it to make your provisional and you work on it, you can go to your definitive restoration. Because we can explore the patient's occlusion with the final restoration in place on the right side and the Arch Pilar still positioned on the left side. So here we can compare. This allows us to compare and appreciate how simple and accurate this CAPS workflow works. So at the left side, patient is just biting on the crucial pillars, and at the right side, he has his final restoration. This is our recently published proof of concept, which was accepted by the Journal of Dentistry. This is a very interesting article because it's a proof of concept of the whole system. And the goal of this proof of concept was to provide a clear and comprehensive visual representation of this new technology. We documented this carefully, resulting in a high-quality publication with a full explanation of the CAPS system. Here we see the patient demonstrating the vertical dimension of occlusion before we capture the virtual interocclusal records. So actually, because there is no bite ring, there is nothing about moldable material, no wax, the patient does not feel the wax or the moldable material. The patient is just doing like this, okay? And sometimes I say to my patient, come, walk around in my office. It's okay like that? Yeah, my vertical dimension is perfect, it's perfect. And then I use the bimanual manipulation technique maybe for the centriculation. I guide to the centriculation, scan, and go to the temporary prosthesis. So CAPS is demonstrating occlusion just before the restoration is fabricated. This is just temporary restoration. And here, with these 3 steps, you can see once again how simple this workflow is. First, we scan the mucosa level multi-units. Secondly, we place the reference scan bodies with the attached peak pins, and we make a nicely accurate scan in the lower arch. And then, at the end, step number 3, place the occlusal pillars and we guide to the bite. Down. 1, 2, 3, 4, maybe 5 seconds. Okay, so this is a more challenging case. We see gummy smile in this patient, so before proceeding with implant placement, the anterior bone had to be reduced. The maxillary implants were virtually planned using a CBCT scan. There is an impacted left canine was extracted, and the anterior bone was reduced just below the smile. Subsequently, 6 bone-level implants were placed with multi-unit abutments. Here we see, and we go with our accurate intraoral scan using peak pins, reference scan bodies of dynamic abutment solutions. And then we see our maxillary arch, all the reference scan bodies nicely together in a chain, and we have made a scan. Digital occlusal records. I use my digital caliper. I use extraoral references, and I make a nice vertical dimension. And I position my occlusal pillars, and I go with my scan. Local bite scans, 1, 2, 3, 4, 5, maybe 6 seconds. Digital occlusal records are very easy with that system. Of course, we are all prosthodontists. We know what's going on maxillomandibular, and we see here this is a system we can use sometime. The clinical assessment of passive fit. You can use what you want to use. This is my system. I use just such a bar, but you can use gypsum or what else. And then I have my PMMA. I just check it out, and I have my temporary. Because this was a difficult case actually. This was removing anterior bone, placing the implants, having a good accurate scan, and then the digital bite illustration. So to define the border of the maximal smile and how to remove the anterior bone, we use this clinical image. Next, reference scan bodies with peak pins are positioned to capture, and we saw a highly accurate digital impression. On the left side, very interesting, the pre-surgical situation. In the middle, cap system, and at the right side, the PMMA implant restoration placed within 24 hours. Demonstrates an excellent functional and occlusal restoration. And now we are getting to the end of this presentation. This is a detailed view of the CAPS workflow and the outcome of the immediate loading restoration, showing both the precision of the workflow and the excellent aesthetic and functional result. Here we are looking at the vertical dimension, the patient's occlusion. On the right side, we have the immediate loading implant restoration, right in my office, immediate loading. And at the left side, the cap system. So it is very interesting to see these two videos together, because now you can see how it works. And at the end of this presentation, I have half a minute left. I want to say CAPS is just a tool. You have to play with it. Thank you for your attention.
kickoff to our industry presentation. Thank you, Philippe, for a fantastic talk. Since some of you walked in after we started, there is a raffle going on, so all of you that walked in the room are eligible for a raffle. Yes, Akanksha? Yeah, oh, okay. Are eligible for a raffle. So because you were